There are growing concerns by some health officials about changes at the federal level when it comes to vaccine oversight. And now health officials here in Maine and in other northeastern states are reportedly exploring the idea of forming their own regional vaccine advisory group. News Center Maine's Alex Haskell looks into this and speaks with vaccine supporters about what they think.
Bad decisions have created chaos at the federal level.
Director of Maine Families for Vaccines, Caitlin Gilmay, is talking about decisions made by Health Secretary Robert F. Kennedy Jr., specifically his recent move to fire every member of the CDC's Vaccine Advisory Committee and replace them with his own picks.
That body has been what families have relied on and physicians have relied on to make sure that we have access to the vaccines that we need.
Gilmay says some of Kennedy's picks for the committee have expressed vaccine skepticism. Kennedy defends the move as a way to restore public trust in vaccine research. But now officials in Maine and across the Northeast are considering creating their own regional vaccine advisory group, first reported by the Washington Post. A spokesperson for the Maine CDC is not confirming or denying any such plans, but tells News Center Maine public health officials in Maine talk and collaborate regularly with colleagues across the country to advance the health of all Mainers. While details on a possible regional advisory group are limited, it suggests a plan to offer alternative vaccine guidance. Dr. Nirav Shah, a former Maine CDC director and former top U.S. CDC official, says states will always take steps to protect the health of their residents, including finding ways to provide vaccinations. Adding, nationwide, we are likely to see more state-led efforts of this sort as the federal government pulls back on parts of public health.
Maine families are really lucky in a lot of ways.
Gilmay says it's because Maine has strong vaccine laws, and there are still many trusted sources for vaccine guidance. Alex Haskell, News Center, Maine.
Gilmay says some of those trusted sources include the American Academy of Pediatrics, the Vaccine Integrity Project, and Maine state agencies that deal with public health issues.